And good evening, everyone. I'm Larry Hansgen, host of Miami Valley's Morning News, and welcome to Marijuana Ohio Decides, a town hall forum that is hosted here at Sinclair Community College and is made also possible by our colleagues at the League of Women Voters, and also it is being broadcast live as well on DATV. During the next 90 minutes, it's not about bad brownie jokes or the movie Reefer Madness. This is about serious issues that will chart the future of Ohio. Your friends and neighbors are going to be watching and listening to see the outcome of this November vote, and the entire nation will be watching Ohio as well. Now, this is a town hall forum, not a debate. That was a week ago. Our goal is to get through as many questions as possible, leave you more informed than you were when you woke up this morning. I want to introduce, first of all, our panel. And on the stage, beginning at the far right, is Chris Kershner, the Vice President of the Dayton Area Chamber of Commerce. Continuing, Ian James, the Executive Director of Responsible Ohio. Tonya Davis, a medical marijuana advocate. Dr. Gary Leroy from Wright State University's Boone Schaaf School of Medicine. And Douglas Berman, Professor of Law, Ohio State University. Our questions, many of which have been submitted by our audience here at Sinclair, as well as the hundreds of folks who have contacted us in advance of tonight's forum via Facebook, will be posed by Laura Bischoff, Columbus Bureau reporter for the Dayton Daily News, and James Brown, our anchor from WHIO-TV News Center 7. Before we get to questions, and we want to get a lot of them out there, we do want to have each of our panelists begin with a 30-second opening statement. Chris?
Great. Thanks, Larry, and thanks to the League of Women Voters and Dayton Daily News for having us here today. I'm Chris Kershner with the Dayton Area Chamber of Commerce. I really hope to be able to provide some clarity for you today. I have no alternative agenda. I'm not here being paid millions of dollars to represent my interests. I'm here to talk about the issue, and the issue is Issue 3 will put a monopoly into the state constitution for 10 businesses. That's not the right way to govern your state. That's no matter what the issue is, marijuana or not. Let there be no doubt that this is a monopoly. Not only does the business community agree, law enforcement, healthcare advocates, but as of 2 weeks ago, the Ohio Supreme Court also agrees. This is a monopoly, and we can talk more in the details about that because I'm sure Ian and others are going to have something to say about it. I hope to provide that information to you today so that you can make a decision when you're going to the polls on November 3rd.
Ian James.
Sure. Thank you for having me here today. Thank you, Sinclair, League of Women Voters, WHIO, and News Center 7. Since 1997, the State House has refused to reform marijuana laws, and it has literally fueled marijuana prohibition that's wasted $120 million a year. It's left countless chronically ill folks suffering needlessly, and it's ruined the lives with harsh and unjust generational penalties. The reality here is that this amendment creates the floor of 10 grow facilities. The state has the ability to increase that number of licenses if demand's not met for the medical marijuana patients and for adult consumers. So while my friend and I may disagree on many things, I'm sure we will tonight, the fact remains that it is a 10 initial grow, and then it has the ability for the state to grow that beyond, based on demand for patients and adult consumers. An important point.
Tonya Davis.
Hi, everyone. My name is Tonya Davis, and I want to start out by saying, one, I do not have a criminal record. I am not suffering from mental health issues or substance abuse, and I have an excellent credit rating. So I hope my words and my heart come through with this. You know, I'm here to represent the patients, and I see a lot of you out here, and I hope to be your voice.
Thank you. Dr. Leroy.
Thank you very much. First of all, I just want to say I am just stunned and amazed at how many people are here. Thank you very much for coming out and hearing about this issue. I'm a Dayton citizen, grew up here in Dayton View, and again, this is important that we have a discussion about this issue. I'm really glad to see that the League of Women Voters is helping sponsor this. I remember grabbing that paper every year around November and sitting there and reading that because I wanted to be informed about what I was voting about as opposed to just having somebody tell me what to do. So I'm here not really representing the School of Medicine, but representing myself as a citizen of Dayton, Ohio, a family doctor, a teacher, a father, you know, just someone that's concerned, and I hope I can provide some education to everyone here. Thank you very much.
Thank you. Professor Berman.
I thank everybody for attending and all the people involved in putting this event together. It's a terrific turnout on a very serious issue, and that's really what draws me. I've long thought, mostly coming from a criminal justice perspective, that marijuana law and policy, marijuana reform is a very serious issue. And I've been disconcerted, honestly, over the last decade that it's been very hard to get serious people to take this issue seriously. In particular, I've found it especially disconcerting that elected officials seem eager to ignore or at times make jokes about the very serious issue of marijuana reform, even as more and more citizens, more and more voters, young and old, healthy and sick, keep saying in poll after poll, keep showing on election day that they're troubled by blanket criminal prohibition and are eager to have a significant policy discussion and significant reforms at least considered. I particularly was concerned that Ohio's General Assembly didn't seem eager to have that conversation openly in public, even as states around the nation, whether it was medical marijuana reform or recreational adult use reform, was coming to the polls. And I was disappointed to some extent that the only way we've had a serious discussion now is because we've got a voter initiative. But I'm pleased we're now having that discussion, and I'm here to help try to ensure not only that the issue gets taken seriously, but that everybody appreciate that there are angles and dimensions to this issue, both in Ohio and nationwide, that the more you study, the more challenging I think it becomes to be very confident. But the more important it is to continue to look for clear, cogent, complete information about what legal reform can and likely will do here in Ohio and nationwide.
All right, thank you, Professor Berman. Before we get into the questions, we have said issue. We're talking about an issue tonight, but it's actually plural because you will be voting in November on 2 issues. And to offer some clarification there, Laura Bischoff, if you could just explain to our listeners, viewers, and our audience here tonight what issue 2 and what issue 3 are.
Sure, Larry. Thanks for that question. Ohio is going to be voting on November 3rd on a major public policy question, which is whether to legalize marijuana. Issue 3 is a constitutional amendment that would legalize marijuana for medical and recreational purposes for adults. It names 10 locations as the only place where marijuana can be commercially grown. And then those 10 sites are controlled by investors who are bankrolling the Issue 3 campaign. And the amendment would also allow for limited home grow by adults, set possession and purchase limits, and establish a state commission to regulate the industry, and allow some 1,100 retail stores. That's Issue 3. Issue 2 was put up by the Ohio General Assembly late in this legislative session. I think they put it through in June. And it's designed to prohibit commercial interests from using the Constitution to set up monopolies, oligopolies, cartels. It's also designed to block Issue 3 from taking effect, even if it passes. It's kind of almost like a poison pill attached to this issue. So considering all that, I wanted to
Yes, please, go ahead.
Yeah, I wanted to ask a question of Professor Berman. Since you are you teach a law class at Ohio State on marijuana law and public policy, and I actually sat in on that class. And you've also done some work, as I understand it, for Responsible Ohio to draft the Fresh Start Act, which is a whole other issue. But can you explain what happens if both Issue 3 and Issue 2 passes? Which one trumps the other?
I can explain that we are going to certainly have litigation in the courts to try to sort that out. It's well established under Ohio constitutional law that when there are two indisputably conflicting amendments, the one that garners the most vote prevails. But my understanding is there's some dispute over whether these two indisputably conflict. And so I've heard stories about both challenges to the legitimacy of Issue 2, challenges to the legitimacy of Issue 3, and you put them together, and all I can say with absolute confidence is it's going to be good for my law students who will maybe have jobs for years to come trying to sort this out. But I do think we're on a collision course, if both issues pass, to litigation that ultimately will have to get resolved by the Ohio Supreme Court.
All right, thank you, Professor Berman. And we will be getting to a question from James Brown from News Center 7 in just a moment. But first, we do need to take a commercial break here. You are listening to Marijuana Ohio Decides on AM 1290 News 95.7 WHIO and also on DATV. And welcome back to Marijuana Ohio Decides, a town hall forum here at Sinclair Community College. I'm Larry Hansgen. We want to get right back to questions for our panelists and our colleague from News Center 7, James Brown.
Thank you, sir. I want to let everyone know we are so grateful for all of the questions that we have here, and unfortunately, we're not going to be able to have all of them asked. But again, a great crowd here tonight. We appreciate your interest, and of course, the listeners and the viewers who are across the Miami Valley. You know, we've talked a lot about this being a monopoly, and I'm telling you, I spent weeks coming up with questions, formulating them. I should have just waited until I got here because I got a whole slew that are better than mine. So, Mr. James, this is for you.
I can't
Why
believe it.
limit the initial license grant to only 10 businesses? Doesn't limiting the number of licenses to be granted go against the idea of a free marketplace where competition determines product pricing?
Actually, you know what? Most states that have legalized marijuana have limited the number of grows so that the state can properly regulate the industry. That's what Laura found when she went to Washington State. In fact, in the Dayton Daily News the other day, it was reported that those 10, the license regulators in Washington State, said they wish they only had 10. They've got hundreds. The problem is when you have hundreds, it's impossible to properly regulate the industry. Paragraph 5, Section F, as in Frank of the amendment, says if the 10 initial growers that all must compete against each other don't meet the demand of the consumer, adult consumer, or the patient, if a single patient doesn't have the strain that she needs or he needs to address their chronic illness, then the state has the ability to add licensing until that demand is met. That's not a monopoly. That's an industry.
James, would you like to follow up with another question for one of our panelists?
So I follow up with this. The state can regulate, and it watches restaurants. County governments can. They can regulate gas stations. Why not provide free enterprise and allow the state to regulate that as well?
Is that a question for me?
Yes, sir.
So, again, you have to start somewhere. Most of the states, actually 10 of the states that have legalized marijuana have started with 10 or fewer licenses. Again, that's so the state can properly regulate it. So starting at 10 is not a magic number, but it does establish the floor. The state and the market demand establishes the ceiling. So if you're looking for the best possible number, what is that number? I don't know that you'll ever come up with it, but I can tell you this, that the patients that need medical marijuana, that are suffering from cancer, the kids that have epilepsy, the folks that have family members with Alzheimer's and Parkinson's disease, our veterans who have post-traumatic stress disorder, they need medical marijuana, and they get that with a yes on 3 vote. And it establishes a system that actually does allow the state to regulate it properly. Now, if you want to have 11, and you can get there, if these 10 don't meet the demand, and most of these folks, I think, will say, or a lot of these folks will probably say, you know what, I don't think they will meet the demand. If they don't, then the market takes over. And that does seem to be a fair market for the state of Ohio. It starts at 10, it grows from there.
All right, thank you, Ian. Laura, do you have a question?
Yeah, let's shift gears here a little bit. Ian just talked about all the diseases and conditions that medical marijuana can help. You know, marijuana is considered a controlled substance by the feds, and the FDA prohibits it. Doctors don't prescribe it. Even in states with medical marijuana, they do kind of doctor notes. So my question, I guess, to Dr. Leroy or to Ms. Davis is, you know, is it medicine? Is it safe? What are the benefits?
So again, from the health standpoint, a number of states have actually legalized medical marijuana. I'm hearing kind of a dual thing here, recreational marijuana, that's one issue, in the medical marijuana. Because it is a Scheduled I, not even a medication, a Schedule I drug, basically very little research has been done on it. It's illegal according to the federal government and such. There have been some anecdotal type of research that's been done on it that shows that there is some benefit. And so again, individuals with chronic pain conditions, multiple sclerosis, seizure disorders and such have shown some benefit from that. You know, when we start medical school, one of the things that they teach us right from the very beginning is do no harm. And so that's where I think the medical community has some problems. The AMA does not legalize or condone medical marijuana, not medical marijuana, but recreational marijuana. And neither does the Ohio State Medical Association. So that's kind of where the medical community is a recreational use.
And Tonya, we're going to get to you, but again, we've got a bottom of the hour newscast that needs to begin, and we will continue with this Marijuana Ohio Decides Town Hall Forum. Welcome back to Marijuana Ohio Decides, a town hall forum. I'm Larry Hansgen, and we are joined again by an outstanding panel of experts, Chris Kershner, the Vice President of the Dayton Area Chamber of Commerce, Ian James, Executive Director of Responsible Ohio, Dr. Gary Leroy, Wright State University Boonshoff School of Medicine, and Professor of Law from Ohio State University, Doug Berman. Right before we went to the newscast there, we were talking about the efficacy of medical marijuana. And James Brown from News Center 7, I believe you had a question for our panelist, Tonya Davis.
Yeah, Tonya, my question is, if this issue passes and we talk about the medicinal uses, insurance right away is not going to pay for it. We heard Dr. Gary Leroy speak to that briefly. It could be several years. How would people who, for medicinal purposes, pay for the drug?
I can't afford Marinol right now. It's $1,200 for a month's prescription. I mean, Marinol is the legal THC, marijuana pill, what have you. My doctor would recommend me using it. My doctor supports this issue. My doctor would rather see me use cannabis than use oxycodone, morphine. And I've been on both of those drugs. Fentanyl patches. You know, one of the things that I have learned through all this is marijuana or cannabis should not be a Schedule I drug. There is no way. If we do legalization, and I'm not saying I'm all for the RO plan. I've got some problems with it. But legalization will open up the doors for our physicians and our scientists and our doctors to study it. And we'll open the doors up so that medicine can be given to the ones that need it the most. I do not believe anyone should go to jail for making that choice, especially when Dayton, Ohio, Montgomery County, Clark County, Warren County, all of our counties are being ripped apart by heroin, methamphetamine, you know, we've got to use some common sense with this issue. We shouldn't even be having this discussion. I begged our legislators for over a decade to do something to help us. And I'll tell you what, I even told them that they would be an Ian James coming into our state that would be doing something like this. And I still begged them. I begged them to help us. Begged them to put it into play a medical cannabis amendment or a bill to try to get it done. You know, Ian, you and I have problems, but we're on the same side as far as we do want legalization. We want prohibition to end. And we may disagree on the amendment. That's okay. That's what our America is for, to disagree. But damn it, excuse my language. It's time to end prohibition. It's time for our law enforcement to go after the bad guys, our sexual predators, our victims, where there's victims.
Thank you.
Tonya, thank you. And Laura Bischoff, your next question.
Yeah, you know, we have, I'm looking at all these cards here, we probably have 100 questions, and we're trying to consolidate them into general categories. So even if you don't hear your particular question asked, we're trying to hit the topics. One area of concern seems to be, you know, business concerns or employer concerns. I want to ask Chris Kershner, you know, generally speaking, how are employers going to handle issue 3 if it passes? How will it conflict with their drug-free workplace policies? What's the general feeling on that?
Thanks. There's some very serious concerns from the business community. And the business community, those concerns are around, one of those concerns is around a piece of the amendment that says employers will be constitutionally mandated to allow employees to use medical marijuana in the workplace. Please don't take that statement as any disrespect to folks that are using medical marijuana. However, when you force an employer to do that and they have a drug-free workplace policy, they are now either in conflict of their drug-free workplace policy to uphold the Constitution, or they're going to be in conflict with the Constitution to uphold their drug-free workplace policy. Either way, that employer set up it for some very serious legal challenges that are going to cost that employer a ton of money, which is going to prevent them from hiring more jobs, which is going to prevent their investments in this area. That's just one issue. That's just one issue. There's other issues in regards to employee productivity, employee legal liabilities, challenges, drug screening costs, hiring practices. There's a lot of things employers have to take into account. This isn't as simple as it seems on the surface.
James?
Mr. James, I see you shaking your head in disagreement. I'm going to let you respond to that, but the follow-up question is, hypothetically speaking, let's say somebody has smoked marijuana over the weekend. They show up at work on Monday. They're required to take a drug test, and marijuana shows up in their system. They might not legally be
Impaired.
under the influence, impaired, but it puts the employer in a difficult situation moving forward. Your thoughts?
No, sir, it doesn't. In fact, there you have the Cleveland Clinic, you have Scott's Miracle Grow, you have the Cincinnati Zoo, and Longaberger Basket all have a policy right now on a legal substance that they prohibit the use of. So anybody that is coming in to apply for a job or has a job there isn't permitted to use it. And if they do, they're not hired or they're fired. And that legal substance today, sir, is nicotine. And so the fact that Chris raises this, it's a red herring. It's really ridiculous because, in fact, if you are a drug-free workplace today, you're a drug-free workplace afterwards. What you're referencing, Chris, is in fact a section that says that if you're a medical marijuana patient, you have the right to self-medicate. The difference, though, is because it's established law, whether or not we like it or not, it is established law, the court has upheld it, that you cannot change an employer's policies on drug-free workplace, zero-tolerance workplace, whether or not you are a medical marijuana patient. You just simply cannot do that. That is established law. That has been held up by the federal court on down, and you know that, but it doesn't stop you from saying that what's false. And I appreciate it. You're sticking to a false narrative, but it's just false.
James? Laura?
Yeah, and another general area is home grow. Issue 3 allows for adults to grow up to 4 flowering plants and have up to 8 ounces of product with them. Some states with legal marijuana allow this, others like Washington prohibit it. Doug Berman, what are the potential issues with this approach of allowing both home grow and then also commercial grow?
The issues are plentiful. One of the things that we're still experimenting with, pardon the pun, is in different states they're approaching the home grow issue in different kinds of ways, and there are solid public policy arguments on both sides. The very arguments you hear about the importance of having regulation and limited commercial grows so that it's easier for the state to regulate, those to some extent are undercut by home grow, because necessarily when people are growing at home, they're not subject to regulation the same kind of way. They're not going to be going through the commercialization process in the same manner. That's one of the reasons why some states, as you mentioned, have prohibited home grow. Conversely, though, and I think this is a valid argument, if one of the goals and one of the beliefs is, look, this is a plant, people should be free to grow it themselves and consume it themselves as long as they don't hurt anybody else and don't distribute it commercially, then that should be part of their right, just as we have conversations about alcohol and home brewing, that's available there too. What we don't know, and I don't think we will know either in Ohio or in any other state that's tried to sort this public policy issue out, is how will this marketplace, both the commercial marketplace and the home grow dynamics, evolve over time? Will we end up seeing, among other things, commercialization of the market of home grow? Will we be going to our Home Depot and our Lowe's and seeing kits for home grow there? It's certainly unlikely while federal prohibition's still in place, but I can go to my local World Market and find, brew your own home beer. It is something that's going to be commercialized. One of the things that I find interesting about this whole debate is there's nothing in our society that's not commercialized in some respect. And so to the extent that anybody on either side of the issue says, let's keep the marketplace out or let the free market regulate itself, there's got to be a balance. And either extreme is not how we do anything in our society. We have this competing balance. And one of the things that I think is so interesting about the Ohio proposal is arguably the home grow piece of the proposal will balance the commercialization. It will allow medical marijuana patients on their own to grow the strains that serve them if they can do that effectively, and certainly in a cost-effective way, perhaps, relative to what it might require to buy from commercial growers. The truth is we don't know. We don't know how it's going to play out, and that's why I'm hopeful if Issue 3 passes, the Marijuana Control Commission there will be very active and will have a collaborative process with the General Assembly, with others in the state, because Colorado's had success so far, to the extent they've had, because all the stakeholders, even those opposed to reform, were involved in the regulatory regime once the voters said this is what they want.
All right, thank you, Professor Berman. And James, a question?
A follow-up here from somebody in the audience, and again, goes along with, TBA, what's going to happen next. I heard that it could be a felony offense if you do not buy from one of the 10 distributors. Is that true? I'm assuming this is someone who is not a home grow person but looking to purchase marijuana from somebody else. Is that potentially a felony?
Well, one thing to keep in mind is all of this is a federal felony right now, so the federal government could come in at any point. That seems unlikely. They haven't done that in other states. The reality is going to be the law has a set of provisions right now about what is legalized. I think among the things that'll be interesting to watch will be if Issue 3 passes, what the General Assembly will do to adjust other laws. I don't believe, although Ian's more familiar with the particulars of Issue 3, I don't think if the General Assembly wanted to decriminalize other activities after Issue 3 passes, they'd be in a position to do that, right? And so, again, what's going to happen down the line? And here's another thing just to emphasize. Colorado, Washington State, Oregon, Alaska now that have full legalization, it's 2 to 3 years before you actually have retail sales there. And that in-between period itself is a period of great uncertainty, both with respect to what the laws are until you have a fully regulated system and what law enforcement's going to do. One part of the story we saw in Seattle, for example, is people who were under prosecution before their reform passed. The DA in Seattle just decided to drop all the cases. He didn't have to do that. The law hadn't become effective yet, but it was his policy choice. We just should not go forward with these cases anymore. Similarly, we've seen different arrest rates in states that have reformed in different areas because different localities necessarily implement the uncertainty of the law going forward. And so I think these are exactly good questions. But anybody who tells you, I know for sure this is how it's going to look 5 years from now, even 6 months after the election is really making predictions, not actually telling you what they know, because there's so much uncertainty as not only the law changes, but how different actors in the system respond to how the voters
Thank you,
decide
Professor
the issue.
Berman. We're going to take a break for our radio audience, and we will continue here at Sinclair.
It's
You're
amazing.
listening to a Marijuana Ohio Decides Town Hall Forum. Next question, Laura.
Yeah, I just had my experience out in Seattle. I did interview the guy who dropped all the tickets, the pending tickets against misdemeanor possession of marijuana, and he had actually campaigned on that issue in 2009. He was a big believer in that it was resulting in mass incarcerations, and it was pointless. But anyway, one of the things that Washington's looking at now is that their law passed in November of 12, same day as Colorado did, and that now they're looking at public use. There's a lot of complaints that you're not allowed to use in public, and that it's hampering any kind of a marijuana green tourism that could happen. Now, issue 3 would prohibit the use in public. Do any of you on the panel foresee a time that as soon as we get this passed, that then there's like a chipping away at it, and that they'll want to kind of keep moving the bar and allow for public consumption at some point? And as it is also in Washington, people can use vaping pens to discreetly use marijuana in public as it is. Anybody have a point on that?
Well, one part of the story, and again, not to drone on, but they've in Colorado seen much greater use of edibles, and there have been justifiable concern about edible products because the distribution of the marijuana and the consumption levels and the effect from them happens at different rates that may be unpredictable. But the lack of available public spaces has led people to be drawn to edibles because you can sneak the edible in at the concert or at the movie theater in a way you can't necessarily sneak in something that you're smoking. In addition, this is part of the tourism story, which is, again, dynamic and unpredictable. A lot of hotels now are smoke-free hotels, so somebody goes, that's part of the public use story. Somebody goes and visits, they're in a smoke-free hotel, they can't smoke there, even though it's legal for them to smoke in a private place, and that's why there's been a push, especially in Denver, to try to create a kind of social club. Again, I don't think we know where that's headed. I don't know where that's headed, both because there's good, viable debates. One of the stories that I emphasize in this setting is one of the reasons I think we've had less of an uptick in driving under the influence is because there aren't, like we have with alcohol, public bars where people drink and then have to drive home. People are buying their cannabis out, as I understand it, and then driving home and then using their cannabis at home. And so, again, usage patterns are unpredictable. We're trying to study this. We're trying to understand this from a public health perspective. It's a balance. I think we're going to see lots of changes and lots of uncertainty about whether the model that's being put in place is going to work long term.
James?
Mr. James, how much pot can these sites grow? And is there an opportunity or possibility for some communities, I know they're doing it in parts of Washington, not allowing these grow sites to move in and for commercial sales? Your thoughts?
The grow sites are actually going to be indoor grow facilities, state-of-the-art. They're going to have climate control. It's going to be controlled access in, controlled access out. You have to be 21 years of age to even darken the doors. It's the same thing with any of the retail licenses that are going to be let for any of the thousands of Ohioans that want to own and operate their own retail stores or their own testing facilities, their own manufacturing facilities, their own medical marijuana dispensaries. How much marijuana will they grow? I'm not certain how much they're going to grow. The plan is to be able to grow this in a phased development so that in year one it may be 100,000, maybe only 50,000 square feet of grow per facility, but ultimately may get to be 300,000 square feet of grow. Is that going to meet the demand? I don't know, and I think that most people don't know what that's going to be. If you believe, as I do, that over 1 million Ohioans today consume marijuana, and you start to look at the amount of marijuana that's being consumed, and you start to look at how much marijuana has to be grown to compress it for oil and extracting it, to provide the medicine, to provide tinctures, to provide topical creams. I'm not certain if they're actually those 10 initial grows that have to compete are going to be able to meet that demand. That's why I say, at year 4, if they're not meeting that demand, the state continues to add licensing until that demand is met. How big will those facilities be? I don't know, and I don't know how much marijuana they're going to grow either.
We need to interrupt very briefly, and Chris, we'll get a question for you, but we're going to rejoin our radio audience here in just a few seconds. And welcome back to Marijuana Ohio Decides. I'm Larry Hansgen. This is a town hall forum as we are joined by our expert panel, Chris Kershner from the Dayton Area Chamber of Commerce, Ian James of Responsible Ohio, Tonya Davis, a medical marijuana advocate, Dr. Gary Leroy from Wright State's Boonshoff School of Medicine, and Doug Berman, a professor of law at Ohio State University. Asking our questions tonight, my capable colleagues, James Brown from News Center 7, Laura Bischoff from the Dayton Daily News. Laura, you had a question for a member of our panel.
Yeah, there's a lot of questions here about legal marijuana opening the door to having children using it. The proponents say that pot is already widely available, and this program means that it's going to be regulated and less likely to fall in the hands of children. Setting aside those arguments, Dr. Leroy, what are the risks of marijuana use in kids, adolescents, young adults, and are they different than the risks for adults using it?
Yeah, as a matter of fact, the medical community is really concerned about what the recreational use of marijuana in the edible forms, the gummy bears, the brownies, the cookies and such, because we just don't have any good data regarding the toxicity of these medications. Some of the strains that were there 10 years ago are considerably more strong now than they used to be. And so if you have those in a kid, in adolescent eats those, then there are cases that have been documented of toxicity and such. And I think Colorado, they were talking about before 2010, there were no ER cases of toxicities of children, and now that's about 5 times that in Colorado. But again, we don't know that data well enough to understand if your kid picks up a laced brownie with marijuana in it, what's going to happen with them. And kids, they're attracted to these little Tide Pods and things like that, so you can imagine if you have something that's looking like a gummy bear or cookie, even a very responsible parent is going to have a situation where that happens. So that's where the medical community comes down with that.
Thank you, Dr. Leroy.
I want to back up here real quick. Mr. James, during the commercial break, referenced how much marijuana might be grown in these 10 different facilities, and I know Chris Kershner from the Dayton Area Chamber of Commerce, you wanted to respond to what Mr. James had said.
Yeah, thanks, James. While we were gone on break, Mr. James was kind of coy and said he didn't know how much marijuana was going to be grown from these farm sites. He knows exactly how much marijuana is going to be grown. In the prospectus that Ian wrote for the funders of issue 3, the 10 funders, he said in there it will be $1 billion at least. At least. That's Ohioans' money. And it's
Going to Mexico right now. Just so we're clear, it's actually going out, it's going to
and I give you the
drugs
respect to
right
talk.
now.
I'd appreciate the same respect to me.
Sure.
That is Ohioans' money, and it's going to go to 10 individuals. It's not going back to everybody else. It's going to 10 individual organizations named in our Constitution. This is the Constitution of the people of Ohio, not the Constitution of Ian James and his 10 rich friends that wrote this amendment.
We are going to pause for our radio audience as we are listening to Marijuana Ohio Decides. Right, we continue while they're in the 8 o'clock newscast, and Laura Bishop, your next question for our panelists.
Well, I mean, let's continue with what Chris was talking about. Ian, can you tell us who are the 10 investor groups?
I'm glad you asked. Actually, it's Oscar Robertson, NBA player, Frosty Rucker, NFL player, relatives of Governor Bob Taft, who's here today.
Governor Taft is against the issue.
I understand that, but in fact, his relatives are going to operate a grow facility in Butler County. Dudley and Woody Taft. Frank Wood, who used to own WEBN, sorry, competitor, I'm sure.
We're off the air right now.
Okay, we're all friends here. And then also, there's David Bastos, there's Jennifer Doring, there is Rick Kirk, there is Nick Lachey, Bobby George, Tony Giardini. There are a number of people that are part of this these investment groups. They are going to certainly, look, they're certainly going to profit. Of course they are. They are also funding this effort. The only way you get to, as Tonya said, she's been working for years to get marijuana legalized through the General Assembly. They haven't done anything. In fact, they've turned a blind eye to it and tried this year to stop this effort because they're unwilling and incapable of doing anything. So those folks are paying for the campaign to make sure that we legalize marijuana, provide medical marijuana and personal use of marijuana.
But Tonya, you have been open in saying that you don't support the support of Issue 3. You do not like a very small group of people getting all the money.
You're right. I have said that. I want to address the kids because it's no different than putting up a bottle of freaking aspirin or a bottle of whiskey or Vicodin or any other type of medication that you want to keep away from your child. Parents have to take some responsibility.
Laura, question?
Here's as long as we're on the 10 growers thing, here's another question from the audience. It says, if only 10 licenses are granted, what mechanisms will be in place to prevent price collusion like we see in the oil industry?
Price collusion, actually collusion is illegal. It's an antitrust violation. It violates the Sherman. Hey, it's illegal. You can't do it. And you're not allowed to, it's illegal to collude. They are not permitted to do so. The Marijuana Control Commission that's going to be seated by the governor, not by anybody in this room, but the governor, is going to be the person to put those folks in place. And that control commission actually oversees this whole process.
I think Chris
That's
Kershner-
actually, the tax revenue, just so we're clear, is actually paid by the marijuana consumers, not by the taxpayers, folks. Actually, the folks that buy marijuana are paying for the Marijuana Control Commission, and that Marijuana Control Commission, those funds actually go to a point, I was going to save this till later, but actually goes to a point of making sure that people that have a need for medical marijuana have access to health care at the price they can afford. There's a sliding scale that is in the amendment that no other state has, and it makes sure that people actually have a chance to get the medicine they need. She just talked about that Marinol costs $1,200. Now, some folks applauded that they understood that was a problem. It's a huge problem. No one else is sitting there bringing a solution. Chris has no solution. There's no alternative. If you want to have medical marijuana, if you want to have the personal use of marijuana, if you want to end the social injustice that occurs today in Ohio throughout this state, then you need to legalize marijuana. And the only way you're going to do that is, frankly, to pass Issue 3. I know that people think that there's some other stuff going on that they can get to, but you're not going to get there.
Laura?
Yeah, I just wanted to give Chris Kershner a quick rebuttal on that one since he was shaking his head vehemently.
If this issue is only about medical marijuana, then you introduced the wrong amendment, sir, to the Secretary of State's office. This amendment is about recreational marijuana. This amendment is about creating a monopoly for a for-profit money grab for 10 individuals. This isn't just about medical.
No, I never said it
That's
was,
a
Chris.
whole different issue that can stand on its own merits and can be decided on its own merits. That's not what we're here to discuss today. That's not what Issue 3 is.
And your alternative is exactly what? Because
James
you've
Brown
sat
has a
silently
question.
by for years.
James Brown has a question,
This
please.
question for Mr. Berman. Okay, so if 3 does not pass, how long before we can expect something else on the ballot for legalization?
That's a fantastic question, and it's a challenging one.
Please allow the panelists to respond.
It's a challenging one for a couple issues. There's some uncertainty about other proposals that have been put forward that their signatures being gathered on. If Issue 2 were to pass and Issue 3 fails, it's not entirely clear whether the proposals that are already out there as alternatives can continue to collect signatures with their existing proposals or would need to submit to get new signatures gathered and to be able to be in a position to get to the 2016 ballot. I'm not sure if there's going to be the time and the resources to collect the signatures to put another proposal on the ballot in 2016. I would expect...
We are rejoining our radio audience now on this Marijuana Ohio Decides town hall forum, and Professor Berman, hate to cut you off, but we want to move on. Our next question comes to us also from James Brown.
Well, to follow up on that, so if issue 3 does not pass, Ian, Tonya will get to you in just a second. Would you throw your weight behind, I guess, the next issue that comes in front of voters?
Well, I have 95% confidence that we're going to pass, we're going to win. We've got resources, we have organization, we have endorsements. We just picked up the endorsements from the ACLU Ohio. We have labor endorsements, we have faith leaders endorsing, we have elected officials joining. You know, look, the reality is this isn't just about endorsements, because I know Chris is going to say, oh my gosh, we have other endorsements too. He does. From the same establishment that sat by silently and didn't do anything to provide any sort of remediation for the folks that are suffering. Didn't provide any sort of a realization that there's a social justice component here, that if you're black, you're 4 times more likely than white folks to get arrested. So he sat by silently while all that was happening. I think that we are going to pass this year. I'm actually very confident, 95% confident, that we will win, because we have an incredible ground game. We are on the air. We're on your TV station. We're on radio. We are in the newspaper. We are working through the process of knocking on doors. We have a very robust campaign going on, and that's what it takes, folks. I know a lot of folks don't want to really address this issue, but it takes resources, it takes money, it takes a lot of shoe leather in the street to not only get to the ballot, but also to run an effective and winning campaign that identifies, advocates, and mobilizes majority support. It's tough. It's not easy, and it shouldn't be to change the Constitution, but it should be easier when we're trying to change the Constitution for medical marijuana, and yes, Chris, also for the personal use of marijuana, because people are consuming marijuana today, and they're doing it illegally, and people are suffering a generational price for it.
Thank you, Ian. Laura Bischoff.
Yeah, we have a number of questions from the audience regarding the growing of hemp. Are you going to let Ohio farmers grow hemp or not? Is that addressed in the issue? Anybody have an answer on that one?
We were actually asked by the hemp folks in the hemp industry not to put it in the amendment. They thought they were going to get it through the budget. I did not think that was going to happen, but bowing to their wishes, we did not put it in the amendment and left it up to the legislature to change.
James? Oh, I'm sorry. James?
Tonya, yeah, we promised Tonya. Go ahead.
Okay.
I am biting at the bit here because this morning we just submitted for the second time the Ohio Medical Cannabis Act or Amendment. And we're searching for signatures for that. So yes, that's a possibility for 2016. I am also part of a personal use amendment, which offers a free market. So if issue 3 does not make it, we will have a couple other options. Responsible Ohioans for cannabis is another option.
Thank you. James, another question for our panel.
Mr. James, this is directed toward you. This is from somebody in the audience. Who came up with the idea for Buddy? And what do you hope to accomplish with Buddy? Who's your target audience?
Sure.
Some would say it's very young legal smokers.
Well,
legal users.
Who came up with Buddy? I came up with Buddy. I came up with Buddy because I thought that, and I know that, millennial voters are irreverent. They like irreverency. Buddy only goes to college campuses, and the folks that really get all exercised about Buddy are the folks that are sitting there saying, oh my gosh, you're trying to push Buddy on kids, or you're a threat to kids. Here's the real threat to kids: drug dealers. Drug dealers are the real threat to kids because they don't card kids. Drug dealers don't card kids when they sell them drugs. It's about cash. It's not about conscience. That's the real threat to kids. Buddy is a fictitious, goofy, and dumb-looking, asparagus-looking mascot. And if we're going to be real honest about it, let's deal with the reality here that so far, prohibition in Ohio has failed, and it's costing us $120 million a year. Don't blame Buddy about it. Blame the legislature and blame the folks that have stood silently while this has gone on for years and years and years.
Laura Bischoff.
So here's another question. It has to do kind of with banking and security. Because marijuana is still federally prohibited, most of the national banks won't touch money generated by these businesses in the legal states. It means that the transactions are largely done in cash. When you have a lot of cash flowing through businesses, sometimes that can open the door to money laundering and embezzlements and other bad stuff. Doug Berman, how have other states dealt with this predicament? And what do you think is going to happen in the future?
States are struggling with it in a variety of different kinds of ways, but one of the things that's sure, not only with respect to Ohio, but as more and more states come online, is more and more industry advocates for the banking industry, for a variety of other means of doing payment systems, are looking for opportunities to get in on the action. I, among other things, have heard from a variety of investors who are especially eager to work on a variety of digital currencies, who are thinking about ways to deal with the banking problem. No one's gotten a great solution yet, though interestingly, it hasn't been as huge a problem. I think it's a problem for the consumer to the extent they want to use cash, but then they usually have ATMs nearby, and banks candidly are making their money by fees on ATMs sitting at the different terminals. And so there are workarounds. That's the nature of a marketplace. And at the end of the day, for a lot of these issues, I think it's not just the consumer interest. The reason there's $1 billion projected in the prospectus is because people clearly want this substance and they're already using it. And so for me, the issue isn't will banks figure it out? The issue ultimately is, will the people change the law and indicate to the politicians that they want the law changed over time? I think especially if Ohio, a bellwether state, votes in favor of reform, we're going to see federal authorities thinking even more seriously about ways to adjust banking laws to facilitate the banking of transactions in this industry, because everybody understands it's actually a public safety risk and a harm to now require them to be all cash businesses.
James, Chris, what are your members from the chamber saying as far as the financial institutions? Have you had conversations with them about this, how they're going to handle this?
They won't take the money. They can't take the money. They're federally regulated. This is illegal on the federal level, and those banks are not going to put their business at risk. That says something about this. The federal government still will classify this as an illegal drug. It will still require that folks that are regulated by the federal government to honor that policy. There's something wrong when a bank won't even take the money. I mean, there's really something wrong with this amendment. And it's not what Ian's going to say, that it needs to be legal on the federal level. There's an issue here. There's an issue here and what needs to be addressed.
There is something wrong.
Laura Bischoff,
Prohibition.
please.
Yeah, let's talk, since we're on money, let's talk taxes. Responsible Ohio is estimating that legal weed will eventually generate $558 million a year in tax revenues once the industry is fully underway. That's a lot more than the $66 million generated in Washington in the first year. Ian, James, what are your assumptions behind those projections? Who gets the money? How's it supposed to be spent?
So this money, we are twice the size of Washington. Washington had a relatively screwed up system. You wrote about it, you know. They had to shut down a lot of their medical marijuana components before they actually opened back up again. So that was a significant problem. Colorado started with medical marijuana and had a hard time getting people to not have medical marijuana needs. A lot of folks were feigning illness to have medical marijuana, and they paid a lower price, they paid a lower tax, and that's been a problem ever since they started going to personal use. We project $554 million a year at stabilization. 85% of that will go to local governments and county governments. At the time when the State House is whacking and cutting away at local governments and local government fund, it's needed. We're going to put money into safety services, into bridge and infrastructure repair. You're finally going to be able to fill potholes with pot money, and that's important. I mean, we have money right now that is not going into, again, I've said this before, drug dealers don't create jobs. They don't pay taxes. And this money can actually be, we can regulate this market, we can tax and test this marijuana, and we can use that money for societal good. Another 15% of that goes into the the Marijuana Control Commission for enforcement, as well as for the health care, to make sure that every patient in Ohio that has a chronic illness that needs medical marijuana can get access to health care at the price they can afford. That's imperative because, as Tonya said, Marinol right now is $1,200. If you don't have the money for that medication, it doesn't matter if you have access to health care. You can't get the health care. You can walk through the door, but if you can't pay for it, it's impossible to get the need or to service the need you have. We provide for that by having a sliding scale to ensure that all patients have access to health care and get the medication at the price they can afford.
James Brown, a question for our panel.
Dr. Leroy, we've talked with you over the years about heroin and the problems and the epidemic that heroin is in our community and across the country. Do you believe, from your medical experience and your profession, is marijuana just the first step in a much larger problem? It's an age-old debate. I hear all sorts of answers when I ask that question.
Sure. One of the things that people have to understand is that we have a serious drug problem, not only in the nation, but in this county. Other than Scioto County, for controlled Food and Drug Administration controlled medications, Montgomery County is second only to Scioto County as far as unintended deaths from prescription drugs. That's a problem. That is a serious problem. So that's why we're so sensitive about the fact that we're potentially introducing something else that could be potentially abused. And that's why we're saying separating the Ms. Davis issues from the recreational thing. And so I have heard that, okay, well, when you do marijuana, are we going to come back years from now and say, okay, well, let's make heroin the next thing, and let's make cocaine the next thing, and so on and so forth. So there's that slippery slope issue that people are saying to us. So I'm not saying that that's what's going to happen. I'm just saying that that is a genuine concern, because we have about 160 individuals that are found dead in this community every year because of unintended prescription drug overdoses. I'm not talking about marijuana. I'm talking about other things. And so that is a concern of ours, that if all of a sudden we have this thing where people are getting certificates from medical professionals to have marijuana, what else are they going to combine it with? Because actually what the coroners are actually finding, that it's a combination of a prescription drug like an OxyContin or something like that, a benzodiazepine like a Valium, marijuana, alcohol. It's combinations that kill people. That's the concern in this community.
Laura Bischoff.
Yeah, just as a follow-up on that, it's the Quinnipiac poll shows that 87% of Ohio registered voters favor medical marijuana, legalizing marijuana for medical purposes. The support for personal use or recreational use is lower. I think it's like 50 to 55%.
55%.
So, why not start with medical and see how it plays out in Ohio, and then go to recreational if that's what Ohio wants to do? Why do it all at once? I guess that's a question for either Ian or
And other
anybody.
states have actually done that. Ohio is going to be,
Ohio will
I
be the
believe,
first
one that does that. Why Ohio?
Yeah. So what's the risk of that, Dr. Leroy?
I know the answer
The
to
question that why Ohio?
I actually, since I helped with this, I know the answer to that, Laura. One of the reasons is because exactly what I just said before. You've got other states that went into the medical marijuana industry in the space, and you had a lot of folks that literally gamed the system. They had night blindness, and they went upstairs to see their doctor, and they came downstairs to the doctor's dispensary. And when they did that in Colorado, and they've done that in California, and they've done that in other states like Washington that had to shut down the medical marijuana dispensary systems and restart the whole process, what they found was people were not willing to gravitate away from the medical marijuana dispensary system that they didn't really need, that they really wanted to have, need versus wanted to have personal use of marijuana. And the personal use of marijuana costs more with taxation than the medical marijuana did. And that was a problem. And what we saw was it actually, by having just the medical marijuana component to this and not the realization that adults consume marijuana, folks, in the state of Ohio right now. They're buying marijuana illegally and telling them, hey, you know what, you need to keep on breaking the law to get the marijuana that you're gonna get anyway, is the same damn system we had with alcohol prohibition. It's stupid. So why not just be adults and say, you know what, you're going to get this marijuana. Let's make sure we have it in a regulated, tested, and taxed manner so that you know what you're consuming, so that you get it and you pay for it at a price that is lower than the black market. It is taxed, so you have a societal gain to that. You help pay for the medical marijuana dispensaries, and you do provide for the medical marijuana patient that does need that medical marijuana for their chronic illness. That's why we did it.
Ian, thank you for that. And we want to take a break for our radio listening audience. Thank you for joining on this Marijuana Ohio Decides Town Hall Forum. All right, folks, we're going to make a quick announcement, and then we're going to get to our next question from James Brown. Right after, we're going to wrap up at 8:30, and right after that, we have to clear out the auditorium, so no hanging around to talk or whatever. You can take the conversations outside. Okay, James, you had a question, and I think for follow-up, I think Professor Berman had something, a follow-up.
Correct.
Yeah, I mean, my question candidly is, why didn't the General Assembly respond to all of this with some kind of medical marijuana reform?
That's right.
Exactly.
And here we have a very clear example, and to me, a sad example is in Ohio in the contrast to Florida. In Florida, there was a robust medical marijuana initiative that was put forward that the General Assembly in Florida didn't like, but their response wasn't to try to pass a blocking amendment or otherwise get in the way of that amendment. Instead, what they did is they passed a limited cannabis oil medical marijuana reform. Now, that's not satisfactory to a lot of medical marijuana advocates, but what it did do is show that the Florida legislature was actually interested in finding a better balance with respect to prohibition policy. And candidly, when I first heard about Ian's efforts and what Responsible Ohio had in mind, I thought, well, if the General Assembly really wants to cut the knees out of this, the easy way to do that would be with medical marijuana reform. And one would think, with the polls showing 87% support, that if you have truly a representative General Assembly, we'd already have this. And the fact that we didn't, to me, something else is going on, right? And that's, again, where I return to being very interested. I'm not as confident as Ian one way or the other. I think it's going to be very interesting to see who shows up to the polls and who votes and how they vote this coming election cycle. But the thing that's been clear to me in following these issues nationwide is there's a disconnect between what the voters and the people want and what the elected officials are doing. And that, to me, is a deeper problem.
Tonya, you wanted to follow up?
I just want to say our legislators have honestly been cowards. When I'm down there, when I was going every week for 3 years, I was going every week. Tonya, I'm with you. You know I'm with you. But then they'd look at me when it come time to push to shove, and they would say, you know, at the end of the day, I have to face my mom and my church. Okay, but since Ian's plan is in effect and on the ballot, he don't have to face his mom and church anymore. He's out of the Senate. I mean, it's all politics. And it's all about money. And we might as well just get used to that unless we start speaking out and start screaming and voting out the people that are ignoring us.
James Brown.
Ian, real quick before we come back from commercials. There'll be one commercial business per 10,000 residents, correct? Who's going to run those businesses? Who's going to run those stores where we can walk in and buy this?
Right, thousands of Ohioans have the opportunity to own and operate their own retail marijuana store. The way that this amendment is drafted is that it allows anybody that wants to be able, that's 21 or older, that wants to be able to own and operate their own store can do so. We follow the alcohol laws. We literally say in the amendment, you have to go to the Control Commission, you file an application, you find a location that you want to have. You just got to be 1,000 feet away from a house of worship, a school, et cetera, et cetera.
Same as the grow operation.
Same as the grow, and then also very similar to what we have with alcohol establishments. So then you've got to put yourself on the ballot for a local option. You have to win the local precinct level voter support. They have to say, you know what, we want you in our neighborhood. We want you in our community. We want to green up this precinct, not wet it up, green it up. And by doing that, we have state authorization, but true local control, so that folks actually have the ability to determine what business is going to operate in their community. But this gives thousands of Ohioans an ability to own and operate their own stores and hire their own friends and family that currently doesn't happen right now.
Chris, you're shaking your head no.
Here's something that Ian's not telling you. Imagine that. Ian's not telling you that there will be up to 1,100 marijuana retail stores in the state of Ohio.
I left that out.
Yeah.
Yeah. That's actually. I know that's more than Starbucks. That's actually not more than all the
Thanks,
coffee
Ian.
shops.
Thank you.
But it's also less than the number of Subway stores, 1,238, if you were looking forward to it, that are actually in existence. And it's less than the
all right, so
25,000
what Ian's not
alcohol permits that
telling
exist
you
in the state
Please,
of Ohio.
one at a time, please.
is that there are 1,100 retail stores authorized in this amendment. Where do they get to buy their edibles from? Where do they get to buy their marijuana from? They can only buy it from the marijuana production facilities listed in this amendment. Hold on. Where can the marijuana production facilities buy their marijuana? From the 10 growers listed in this amendment. That is the monopoly. That is what the 10 folks got together. They wrote Ian a check for $20 million because they're going to make a lot of
Need to
money
cash that.
on this.
And again, our radio audience has rejoined our Marijuana Ohio Decides Town Hall Forum here at Sinclair, and we are winding down. We have just a few minutes, and and we've just barely scratched the surface. So, Laura Bischoff, one final question for our panel.
Sure. Other states, the driving forces behind legal marijuana have been those who've been concerned about criminal justice reforms. They say the war on drugs has failed. It's led to mass incarcerations, falling largely on people of color. We're hearing some of those same arguments from Responsible Ohio. But in general, and I guess this could be a question for each of you, if you could answer briefly, what would be the benefits for Ohio's criminal justice system if we were to legalize marijuana?
Let me start that, because
Tonya, we
I'll
only have
tell
a few
you what
moments,
it'll do.
Tonya.
Go ahead.
It will free up our jails so we can put in sexual offenders, child molesters, murderers, domestic violence. If there's a victim, there's a crime, and they belong their ass in jail. Excuse my language.
To me, there's a broader story here, which is we've tended in our country over the last 15 to 30 years to treat every social problem as a criminal justice problem. And only now are we fully understanding the economic, social, human costs of the hammer for every problem that we see. I'm hopeful, whatever the vote is here, that the message gets out that this may be a public health issue, this may be a public safety issue, but treating it as a criminal justice issue, just like we tried and failed with alcohol prohibition, is not the right solution, not only for this problem, but for a range of public health and personal problems. And so I'm hopeful, whatever the vote is, that the voters go out and tell their representatives, whether we vote for Responsible Ohio or not, try alternatives to criminal justice, because that is not the best way for government to be interacting with its citizenry.
Dr. Leroy.
So my colleagues to the left and right of me have already spoken their piece. All I want to go back to is that you've heard some spirited debate this evening, and both sides of the equation. Such, you as Ohio citizens really need to take all that you've learned, learn more, take this out to other folks, your friends, your family, and such, and tell them the facts, and then vote your heart, vote your mind, vote what's best for Ohio.
I don't think we could end on a better note than that, and I echo the sentiments of Dr. Leroy.
Larry?
Do your homework, please. Thank you so much for coming out here tonight. And remember, we do have a live radio broadcast that continues on AM 1290 and News 95.7 WHIO.